Why are safe sex practices essential for preventing reproductive cancer? Imagine a simple choice that can significantly lower your risk of developing certain types of cancer. That choice is practicing safe sex. Reproductive cancers, like cervical cancer, are often linked to infections that can be transmitted through sexual activity. The most notable of these is human papillomavirus, or HPV, which is responsible for the majority of cervical cancer cases. When you use safe sex practices, you reduce the chance of catching HPV and other sexually transmitted infections that can lead to cancer. Using barrier methods such as condoms during sexual activity is one of the most effective ways to prevent HPV transmission. Studies show that consistent condom use can lower the risk of HPV infection and reduce the chances of developing precancerous changes in the cervix. Women whose partners regularly used condoms had fewer HPV infections and were less likely to develop cervical cell abnormalities that could turn into cancer. This is because condoms act as a physical barrier, preventing the exchange of bodily fluids that can carry viruses. Abstinence, or choosing not to engage in sexual activity, is another powerful method to prevent HPV transmission. Since HPV is primarily spread through skin-to-skin contact during sex, abstaining from sexual activity almost completely eliminates the risk of infection. While this may not be practical for everyone, it highlights how avoiding sexual contact can be a highly effective way to prevent reproductive cancers linked to HPV. Education about safe sex is also key. When people understand how infections spread and the importance of protective measures, they tend to adopt safer behaviors. This includes delaying the start of sexual activity, having fewer sexual partners, and consistently using protection. Such behaviors have been shown to lower the risk of HPV and other infections that can cause reproductive cancers. Vaccination adds another layer of protection. The HPV vaccine is highly effective at preventing the types of HPV most often linked to cervical and other reproductive cancers. When combined with safe sex practices like condom use and limiting the number of sexual partners, vaccination offers the best chance to prevent HPV infection and reduce cancer risk. While HPV is closely associated with cervical cancer, other reproductive cancers are less directly linked to sexual behavior. However, practicing safe sex still promotes overall reproductive health by reducing the risk of infections that can affect reproductive organs. Additional preventive measures, such as voluntary male circumcision and quitting smoking, can also help lower the risk of HPV infection and related cancers. In summary, practicing safe sex is a vital part of preventing reproductive cancers. It helps stop the spread of HPV and other infections that can cause serious health issues later in life. Combining condom use, abstinence when appropriate, sexual health education, and vaccination creates a powerful strategy to protect your reproductive health and reduce cancer risk. Always remember to consult healthcare professionals for personalized advice and screenings to stay informed and proactive about your health.